Hi, my name is Jenny, and today I'm going to talk about obesity in adolescents. This is for the class nutrition across the lifespan. So for this case, we have a female. Her age is 14 years old. Her height is 62 and her weight is 152.9 pounds. The method of evaluation that we use for adolescents, it's the percentile. So with percentile, we calculate the BMI, and in this case, she has a 96. So if we see the chart, when you are in the more than the 85 percentile, it's considered overweight and obesity. When you are under the fifth percentile, it's considered underweight. So in this slide, I have like an example of the percentiles, how it has to look like. So this is based on the girls from 2 years to 20 years old. It's from the CDC. So the way you have to measure, it's putting the age in the bottom is here, 14, and then you look for the weight. It was almost 160. So she's passing more than the 95% from the 90, I'm sorry. So she's considered overweight by her age. This is an example. So this is most of the graphic that we use for the childs and adolescents. So when we talk about obesity, what is that really means? So the obesity is a person that present an excessive fat accumulation in the body. So you can see in the image how the body looks like, the bones, and inside the bones you have the organs, and your body has this excess of fat. And most of the time is considered obesity if you are over 30. If you are over 25 is considered overweight. So what's the reason of the causes that obesity? So if you can develop obesity if you have a high intake of carbohydrates, proteins, fat, and drinks. This includes juices, sodas, and all that of drinks. Um, Additionally, the lack of exercise increases storing of energy as a fat. This means that if you don't have any movement or any activity and you have like a bad habits, this can cause obesity too. And the factors that can include this is not sleeping well, high stress, and metabolic syndrome, PCOS. It's a polycystic syndrome, genetics, medicines, and environment. The nutritional implication of the condition is associated with diabetes, hypertension, and cardiometabolic risks. So it is really important to keep an eye to be in a healthy way. That way you can develop of the chronic disease. So for this patient, we asked her a 3 meal day record. So I tried to put what was the real intake that she consumed versus the intake that she needs to eat. So the first day she consumed 3,424 kilocalories, and she has an excess of calories, carbs, fats, and sodium. And she has a low intake of folate, vitamin C, vitamin D, fiber, protein, and magnesium. The second day, she consumed almost 5,000 kilocalories, and probably the excess was of vitamin B3, folate, sodium, fat, carbs, and calories. The third day, she consumed 2,000. almost 3,000, and it has a low intake of vitamin C, vitamin D, vitamin E, vitamin K, magnesium, protein, and fiber. Most of the time, she's been eating a lot of calories, carbs, and fat, sodiums. So as I mentioned in the other side, in the other slide, this can promote more her gain weight. This is one of the reasons she needs to change. So let's see. So in this slide, we have the labs from the patient. Even that her intake of sodium is really high, she's under the normal values. Potassium are in the normal values. However, the glucose, LDL, are really high, and HDL is low. So fasting glucose, 1 in 5 adolescents have prediabetes in the US, and this is because of the excess of sugar in the blood. If prediabetes is not treated, it can cause heart disease, kidney, and you can have problems with your sight. She needs to be careful with her glucose. She's taking a lot of sodas, cookies, and a lot of carbs, as I mentioned before. And LDL is always called as a bad cholesterol. And having a high LDL can cause plaque in the arteries, known as atherosclerosis. And HDL, it helps to remove LDL from blood. However, if the HDL is low, it's because the LDL is really high. So we need more of HDL and not LDL. And if the patient do some exercise like 20 minutes 3 times a week, it will increase the HDL, and it will have a lose weight, and it will help her body. Well, here I have the nutritional assessment. That's my recommendation for her based on Mifflin formula. I have a metabolic, well, the basal metabolic rate as a 1,447 kilocalories. Plus, if we multiply for the physical activity, that probably is sedentary, it's intake of 1,737 kilocalories. But we want that the patient lose weight, so we add the 200 calories as a deficit. It give us 1,537 kilocalories. So these calories will be ideal to her. That way she can start losing weight and change her habits. So for this slice, I made the 3 days meal plan, where I try to put like sweet food, like fruits. I add French toast. That way she don't feel that she doesn't feel that anxious when she don't have any sweeten. And the diet will include fruits, as I mentioned before, vegetables, whole grains, and she needs to increase the intake of water and just try to get rid of the sodas. CDC recommends that children and adolescents between 6 to 17 years old should do 60 minutes of moderate vigorous physical activity. And for her, I will recommend to start with maybe 10 to 15 minutes walking, and each week trying to increase 5 minutes until she reached the goal of the 60 minutes. And this will help her to have a better a better a better health to her. And I hope she can she can make the diet. I try to add an inexpensive menu. I didn't put anything crazy like salmon or something really expensive because I know that the patient is low income, and I think she can follow this diet and it will help her to get a better health and try to avoid any chronic disease as I mentioned before. And that be all of my presentation. I hope you like it and it's well explained. And as I mentioned, my patient it's a low income, so I will highly recommend to go to any organization, any food bank, or any program in the area to ask if she qualified to get help. That way, it will be easier to make the diet plan and start changing their habits. And as I mentioned in the beginning, environment it's really important. So the support of the family it will be a key to the success of this patient. Thank you.